Welcome to today's discussion session on layers of wound dressing. So the layers of wound dressing includes the non-adherent layer, the antibiotic layer, the capillary layer, the absorbent layer, the restrictive layer, and then the strap layer. The mnemonic to remember this is NACARS. The non-adherent layer, the antibiotic layer, the capillary layer, the absorbent layer, the restrictive layer, and then the strap layer, NACARS. The non-adherent layer is usually made up of what is used for the non-adherent layer is the tallgrass mesh, and the tallgrass is a mesh that is impregnated with Vaseline, and alongside there could be antibiotics impregnated with the mesh as well. So examples of tallgrass include Sofra-2, wherein the antibiotic present is soframycin. So alongside the mesh and then the Vaseline, you have soframycin as the antibiotic, and then you have Steritin. Steritin is another tallgrass, wherein the antibiotic present is framycetin. So alongside the mesh and the Vaseline, you have framycetin. And then you have Bactigras. Bactigras is another tallgrass, wherein the antiseptic agent present is the chlorhexidine, and then you have Gelonate. Gelonate is just made up of only a mesh and Vaseline. It doesn't have any antibiotic or antiseptic agents. And you have Biodress. Biodress contains chlorophyll alongside the paraffin, that's the Vaseline and the mesh. So this is the non-adherent layer. So for the antibiotic layer, usually povidone iodine soaked in gauze is used for the antibiotic layer. And then if the non-adherent layer you use contain an antibiotic, it can also subserve for this antibiotic layer. The capillary layer is formed with wet gauze, and usually done when the wound is actively exudating, when the wound is weeping actively, and it can also be subserved by the antibiotic layer, because already you used gauze soaked in povidone iodine for the antibiotic layer, so you can also subserve for the capillary layer since there is a gauze present. Then we have the absorbent layer. For the absorbent layer, Gamgee is usually used. Now, Gamgee is formed by layers of cotton wool sandwiched between two layers of gauze. So Gamgee is more like you're putting lots and lots of cotton wool between two layers of gauze, and absorbs. So it absorbs any moisture present within the wound. And then we have the restrictive layer. For the restrictive layer, it is not always present as a layer of wound dressing. So, and materials used for the restrictive layer includes the POP back slab, POP cast, fiberglass cast, and these are used in cases of fractures or when dressing is done over joints to limit excessive movement of that joint that may impair wound healing. So it's important for us to know that the restrictive layer is not always present as a layer of wound healing. And then finally we have the strap layer. The strap layer is usually the last layer of wound dressing, and is the crepe bandage is used for the strap layer. And as I said before, not all of these layers are always present in every wound dressing, but some of them are constant in most wounds we see. For example, the strap layer that is made up of that's wherein the crepe bandage is used. So in conclusion, these layers are modified depending on the kind of wound involved. All 6 layers may not apply to every wound, so it's important to note that all of the 6 layers we just mentioned would not apply to every wound. So it's important to understand the kind of wounds that require certain dressing. For example, in a burn wound that is actively weeping, you would want to use a capillary layer to absorb the moisture. So as a way to recap, the layers of wound healing includes N for the non-absorbent layer, A for the antibiotic layer, C for the capillary layer, A for the absorbent layer, R for restrictive layer, and then S for the strap layer. Thank you very much, and I hope you enjoyed this presentation.